Hi, I'm Dr. Rob Mordkin, the U.S. Medical Director for LetsGetChecked, and here to talk to you briefly about erectile dysfunction. What is erectile dysfunction? Well, it's a topic that many men steer away from talking about or are understandably challenged when they have to talk about it. But erectile dysfunction is essentially defined as difficulty or inability to obtain or maintain an erection suitable for intercourse. What are the causes of erectile dysfunction? Well, erectile dysfunction, in terms of a diagnosis, can be challenging because it can be multifactorial, and sometimes we don't even ever really find the true cause. But there are some certainly known causes, or at least increased risk factors for erectile dysfunction. Medications can often cause problems with erectile function. Specifically, medications that treat blood pressure or medications that can affect mood disorders are linked very often to this side effect of the medication. And a man might find that they'd had no issues with erectile function until they started that new medication to manage their blood pressure or to help with their depression. And all of a sudden now erectile dysfunction has appeared in their life. Other causes for erectile dysfunction can be disease states. Most commonly, diabetes. Diabetes often will lead to erectile dysfunction as well as a whole host of other potential problems. Neurological diseases, spinal cord injury can lead or at least contribute to erectile dysfunction. What about diet? Well, obesity, which is very prevalent unfortunately in the United States today, has been linked to a higher incidence of erectile dysfunction. Heart disease. There's definitely a link between heart disease and erectile dysfunction, and actually, interestingly, occasionally a man might present complaining of erectile dysfunction, but as they begin to go through the evaluation, it could uncover some underlying heart disease that needs attention. And in terms of other risks or other lifestyle things that can lead to it, well, drug use, marijuana use specifically, alcoholism, all of these things have shown to have increase in erectile dysfunction. How do we evaluate for erectile dysfunction? Well, there may be some baseline testing that would be helpful here. Testosterone is one that's often implicated, and so getting a baseline testosterone level can't hurt. As well, lipid profile and cholesterol, looking at overall heart health and vascular health is important to establish a baseline. Are there things that can be done to improve erectile function? Well, of course there are. Limiting some of those lifestyle choices that are bad, in other words, cutting out tobacco use, limiting alcohol or drug use, these can be helpful, but exercise can be helpful. So weight loss, controlling your weight, improving your diet, they don't hurt erectile function and often they will help. Are there other things that can be used to help with erectile function besides lifestyle changes? There are. And these are the commonly prescribed medications that almost everybody will see advertised if you watch any media these days. These are the medications like Viagra or Cialis. These are safe medications in the properly selected patient and can impactfully improve erectile function if used correctly. So looking at those baseline tests that we talked about, looking at lifestyle changes, and then perhaps considering medication to augment sexual function can all be helpful for a man who's struggling with this challenging and very common concern. If you have any more questions or concerns and would like to know more about diagnosis and management of erectile dysfunction, I invite you to go to LetsGetChecked.com, where through live chat or a telephone call, you can actually speak to one of our nursing team to gather a little bit more information.